Hey guys, Dr. Horst here. Today, I wanted to talk about wrist, hand, and thumb pain. A lot of us have been doing a lot more of this, a lot more of that, a lot more of that, because of what's been happening. And if you already did this for years and years, you probably already know what I'm talking about. Again, wrist, hand, elbow pain, all that good stuff. So today I wanted to show you guys how to use your massage gun in order to help make that get a little bit better. A lot of these things are hard to work on at home, but this is the closest way that you can kind of reproduce some of the things that I would do here in the office. So we're going to start with, let's say we have some thumb pain right up in here. A lot of this big part of your thumb, it comes from a little bit higher in our wrist, but it takes over, and it's a lot of this motion. And if we look at it, it's a big muscle. So what we want to do is we want to start with it short, and we want to open it, and we want to lengthen it. So the easiest way to do that is you just start with your massage gun. You start with your hand closed, and then you open it. Close it, open it. Close it, open it. And you could do basically the whole palm of your hand, but spend most of your time just working on the thumb there, right there, because it makes up the majority of the palm. So after doing that for about 30 seconds to a minute, then you want to go on to the next part, which again is going to be more wrist flexion. So again, back to this motion, we gotta make it so that way this is moving a little bit better. So same idea. We're just going to start with our arm like this. We're going to extend this, and then we're going to extend that wrist and that hand. So we're going to start up right there, and we're going to extend that arm, extend that wrist and that hand, just like that. Okay, now same thing. I'm just going to put it on level 2. Start with my arm like this. I'm going to extend it, go to there. Extend it, go to there. Now a few things that you want to take into consideration when you're doing this. You want to stay away from this point of your elbow. All the muscles that control that flexion, they insert right there onto that elbow. And if you're putting pressure on that, you're going to make your issues worse. And you might make your pinky fall asleep, and just bones don't like to be vibrated on. They just don't. And since we're already talking about this, let's talk about the other side. Your lateral epicondyle, or the lateral part of your elbow, again, from doing all these extension things that you do with your fingers, just constant gripping, repetitive motion. And I see a lot of teachers that they're experiencing this right now, as well as students, because they're doing more typing than they ever have their whole life. And so same idea, but we're going to do the reverse motion. So this time we're going to start with our arm like this, and we're going to extend it, and we're going to go down. So from the side, I'm just going to start here, go down, okay? So again, with level 2, we're going to start here, go down. We're going to be moving all the way down. Again, we want to avoid the point of the elbow. If you piss that off, it's not going to feel very good, and you're just going to make your problems worse. So give that a try. If this is something that you guys really like, go ahead and hit that subscribe button down below, and I'll see you guys next time.